Good evening.
Good evening.
Hey, it's great to see everybody. Welcome to this month's installment of the Ignite series by Radian Partners. If you're here, it's most likely by a special invitation, is because there's something that makes you unique, and we share that. It's that we are 64 years old, and by the time Bobby comes back and speaks next year, we will turn 65, which means that we have a couple of decisions to make about a very important aspect of our life, and that's Medicare. What it is, how it works, when do you enroll, how it compares to the supplement plans, should you have a supplement, should you do Medicare, right? And there is nobody in the South better at helping you make that decision than Bobby Jones with Delta Benefits Group. He was here last year with the updates on the program, and it's amazing what he's going to share with you tonight. So, Bobby, did you have a chance to bring your book?
No.
No.
The books that we've written?
That you wrote? Yeah.
You can go online and get it, though.
All right. He'll let you know about how to get a copy of his book that has everything that he's going to present tonight, so it's great. So I'm going to shut up and turn it over to Bobby. All right? So, all right.
All right. Thank you. All right. Surprised that you guys are on Medicare. I'm looking around the room and think everybody seems a little bit too young. So my name is Bobby Jones. My company is Delta Benefits Group, and I'm going to take about the next 2.5 to 3 hours to take you through Medicare and make sure you understand the ins and outs of it until you say, okay, I don't want to go on Medicare. So I have written the book, like Larry mentioned, Medicare for Beginners. It's a guide to understanding and enrolling in Medicare, and I'm out of them. And it's outdated anyway because the new numbers are coming up, which we don't have yet. The new numbers don't come out until around November, the 1st of November. I've had a sneak peek at a few of them, so I can kind of give you an idea of what they're going to be. But for the most part, we're going to talk about the 2024 figures, but the concepts are exactly the same for the most part. The only difference is going to be in the numbers. However, I will say that this year there have been more changes, especially as it relates to drugs, than I've ever seen. And I've been in this business for a little bit. So we do have some things coming up that we might want to discuss. Is anybody already on Medicare, or is everybody just coming on? You're already on Medicare, okay. Good, so you'll kind of have an idea of what I'm talking about on some of these things. So let's go ahead and get started. And very basic, Medicare is made up of working parts signified by letters. Everybody knows this, A, B, C, and D. And we're going to go through each of them in order to get a better working knowledge of Medicare. Now, this is what I want you to understand. And everybody can hear me, right? Do I need to stand in front of the microphone? If I stand in front of the microphone, you're not going to be able to see the screen as much. But there's 2 ways you can get Medicare, okay? There's only 2 ways. And you can't mix and match them. You have to choose one way or the other. The first is original Medicare, and that's where we're going to start our discussion. The second option is Medicare Advantage. Like I said, you pick one or the other. One's not any better than the other, but they are different, and I will explain the differences to you. Starting with original Medicare. Original Medicare is made up of Part A, Part B, Part D, and for reasons that I'm going to show you, you're going to need, in my opinion, if you go this route, a Medicare supplement, okay? So Medicare Part A is going to cover inpatient hospital coverage, inpatient skilled nursing facility, hospice care, and home health care. Now, this is why I'm going to say you're going to need a Medicare supplement. It's because of the deductibles and copays that come with Part A. And again, remember, these are 2024 numbers. The numbers will obviously go up a little bit in 2025. If you're admitted into the hospital in 2024 with Medicare Part A with no supplementation, you're going to have a $1,632 deductible when you go into the hospital. Now, most people are familiar with annual deductibles. This is not an annual deductible. This is a per benefit period deductible. And a benefit period is defined as when you have been out of the hospital for 60 days, a new benefit period begins. okay? So if your timing is horrible, paper towel. If your timing is horrible, right, you could have 4 or 5 of these events over the course of the year. If you go into the hospital January 1st, you get out January the 3rd, you're going to get hit with that deductible. You go back in March the 5th, you're going to get hit with that deductible again because it's greater than 60 days. Okay? Now, that deductible is going to cover the first, and we're going to talk about consecutive days in the hospital. It's going to cover the first 60 consecutive days in the hospital. All right? Very unlikely that this is ever going to happen, but that will cover, there's no copay for the first 60 days. So that $1,632 covers the first 60. But in the unlikely event of a longer stay in the hospital, and let me add this real quick. This is not as really a sermon as much as it is a discussion. So holler out questions, raise your hand. I'll be glad to answer any questions along the way. Don't let anything get too far gone so you don't remember the question. If you're in the hospital longer than 60 days, 61 through 90, it carries a $408 per day copay, right? Again, highly unlikely that it'll ever happen, but it's good to know in case it does.
And that's in addition to the 1,600.
That is exactly. But remember now, these are consecutive days. So if a person's in there for 90 days, whatever 30 times 408 is, plus 632, so you're exactly right. Okay? In the less likely event of a longer stay, days 91 through 150, it doubles to $816 per day. Again, building a case for supplementation. All right. Now those last 60 days, days 91 through 150, are called lifetime reserve days. In all actuality, you're given 90 days of continuous coverage in the hospital. They give you a bonus 60 days, okay, which are the lifetime reserve days. Once they're used up, you're on your own. Okay, so let me give you an example. A person's in the hospital 153 days and lives to tell about it, which is highly unlikely because they'll catch something else while they're in the hospital. But all of this is going to apply days 151 through 153, they're completely on their own, right? 2 years later, they go back into the hospital for another extended stay. Now, all they have is 90 days of coverage because they used up all of their lifetime reserve days. So in my example, days 1 through 90 are now covered. Anything beyond 90 is not going to be covered. Okay? Spoiler alert, a Medicare supplement is going to take care of all of this, so don't worry too terribly much about it. A skilled nursing facility, Medicare is going to cover the first 20 days in the hospital. Days 21 through 100 is a $204 per day copay in a skilled nursing facility. Okay? The premiums for Part A are typically free. I'm sure all you guys are not going to have to worry about that. As long as you've worked and paid in for 40 quarters, then your Medicare Part A comes at no charge. If not, if you work 30 quarters to 40, it's $278 a month. If you worked less than 30, it's $505 a month for Part A. Okay? Now, a spouse gets their husband's credit for working, so if the spouse didn't work and the wife or the husband did, then you don't have to worry about that because you will qualify for the 40 quarters. Moving on, questions on Part A. Pretty straightforward. Hospital coverage, big deductible, lots of copays. Don't stay in the hospital a long time, especially if you don't have a supplement.
And all of this is still under the original Medicare.
We're still talking original Medicare. Exactly.
And if you're in the hospital, you will get a bill from the hospital even though Medicare pays for it?
You'll have a deductible. That deductible will be right, because so
You'll see a line bill.
Exactly.
For bed pans, bed sheets, or underpads, whatever they call, and okay.
And then you'll have the deductible because they're not going to cover the first $1,632. Okay? Anybody else? Got it? All right, so Medicare Part B is going to cover anything medically necessary inside a doctor's office. It's going to cover outpatient surgeries, cataract surgery, shoulder replacement, hip replacement, anything that's done in an ambulatory or an outpatient facility is going to be covered by Medicare Part B. Durable medical equipment, diabetic supplies, crutches, wheelchairs, hospital beds, anything like that that you have to get will fall under Medicare Part B, as is that long list of preventative services that they want you to have done every year, or not every year, but periodically, the colonoscopies, the mammograms, and things like that. As long as they're preventative, they fall under Part B without any kind of copay or deductible. If they're diagnostic, all of the rules to Medicare, which we'll get to on the next slide, Part B will apply. Difference in preventative and diagnostic. Preventative is your idea, diagnostic is the doctor's, okay? Chemotherapy, and a lot of people don't realize that. Chemotherapy falls under Part B because now it's pretty much done exclusively in outpatient facilities, specifically for chemotherapy. So the deductibles and copays for Part B are a little easier to explain because there's a one-time, and we'll go back now to a one-time year deductible, and this year, 2024, it was $240, okay? After the $240 deductible is met, it's an 80-20 split between you and Medicare, okay? The important thing to know is that there is no cap. There's no max out of pocket. Is anybody still on group insurance or, right? So you know you have a max out of pocket. Medicare doesn't have that. So you think, well, doctor's visits, durable medical equipment, how bad could that be? But remember that chemotherapy falls under Part B, and chemotherapy is $12,000 to $15,000 per treatment. So 20% of the Medicare approved amount of that could be devastating, okay? This is hard to read, I know. 2024, the standard Medicare premium was $174.70, okay? IRMA is our friend IRMA, which is the income-related monthly adjustment amount, the penalty for making too much money. It always trails 2 years. So the premium that you pay for 2024 was based on the modified adjusted gross income for 2022, okay? And if you can see, filing jointly, the benchmark was $206,000. Now, that will go up. It goes up every year. So the benchmark in 2025 will probably be 210, 213, somewhere along that lines, which is a good thing. So allows you to make more money. And it will be based on 2023. And you can see as you go down the list up to 750,000. I don't know what that last line says. Oh, there's this greater than 750. Is there any way to change that at all to see that bottom part? No?
Look at your laptop's being really.
Do it with my laptop?
No, you can't read it there.
Oh, okay. It's okay. It goes up to 700. Anything above 750,000, I believe, is $559. Okay. So going back to that, I do the one number that I have heard more than one time for 2025 is the standard premium for Part B, and I've heard $185. So it's going up, but not horribly, from $174.70 to $185. We'll know in another couple of 3 weeks. So how to enroll in Medicare's Part A and B. So if you're getting Social Security and you're coming on to Medicare, you don't have to enroll in Part A and B. It's done automatically for you, and people will just get their Medicare card in the mail. If not, there are 3 ways to enroll. Number 1 is you can visit your local Social Security office. Ours happens to be at Cleveland and Monroe. So if you guys want to go down there, that's a fun trip. Or you can go and call 800-772-1213. You will probably be on the phone a while, have a book, a crossword puzzle, or something to do while you wait. Most of the people prefer number 3 is let me do it for you online. So we do it at no charge. If you're going to sign up for Medicare's Part A and B, or if you're already on A and still in your group and you're going to retire and go to B, we will do that for you. But you're welcome to go to Cleveland and Monroe and do it yourself.
Does that mean that if you do it through the Social Security system, you are then taking Social Security even though you may not want to do that?
No. And that's a good question, because a lot of times people say, well, I'm not taking Social Security, I don't want to go on Medicare. You don't have to, it's not mutually exclusive. You can be on Medicare without being on Social Security.
Okay, that's it.
Right. Okay. So we're still on original Medicare. Yes, sir.
Do you have to something that you have to or required to do when you turn 65?
No. If you have what Medicare or what CMS, and CMS, you'll hear me use that a lot, it's the Center for Medicare and Medicaid Services. If you have what they call creditable coverage, which is coverage which is equally as good as Medicare, all group is, then you do not have to sign up, and you will have, when you're ready to sign up, what's called a special enrollment period, which we'll go through in a minute. But so no is the answer to your question. You don't have to sign up as long as you have creditable coverage.
So, just to follow up real quick, I own my own company and I'm still sort of employed.
Okay.
They hadn't gotten rid of me yet. And so I have, I have medical coverage for everybody, and I'm still on that.
Mm-hmm.
But I thought I read somewhere that I needed to at least enroll or register with Medicare.
Well, it's a good idea to go ahead and get your A. It's free anyway, so that you may as well get it. Obviously, if it's free, there's no penalty on a late enrollment for it, because if it's a 10% penalty on zero, it's still zero. But it's effortless, and we can do it with a phone call. If you want to sign up for A, we'd be glad to help you with that. And again, it doesn't cost anything.
Can you use it as a secondary?
How many people are on your group? More than 20 or less than 20? All right, if it's more than 20 people on your group's going to come first, and Medicare would be second. All right, if it's less than 20, Medicare is going to be first, and your group's going to be second. Now, I can make an argument, or at least a case, for Medicare is always going to be better because it's less expensive in most cases, and better coverage. Okay? And I'll get to that in just a second, but there's always an argument to be made. Unless you fall under one of the big IRMA categories to where you're paying a ton for your Part B, then a lot of times Medicare is going to be less expensive, and I can promise you the coverage is going to be better. So especially if it's set up correctly. Okay?
Isn't there a case where if you're working for a company and that company is providing you with a health plan, you still need to actually register for at least A, because if you don't, later on, then it may cost you about 30% more.
30% more of what?
30% your premiums on Medicare.
Well, 30% more of zero is still going to be zero. So there's not a penalty, there's not going to be a financial penalty for A if you sign up late.
Okay.
But it's good. I mean, I always advise people to go ahead and do it. Get in.
Okay.
Right. Because again, it doesn't cost anything.
Right. B, what about B?
B is the one that you can wait for if you're on, because as a matter of fact, if you're going to stay on your group, I'm going to advise you to not get B, because it's going to be at the very least $185 a month that you don't really need to spend.
Because I'm getting benefits.
Exactly. And if you're on a large enough group, it's going to come first anyway.
Got it.
Yes, sir.
You said that up to 20 and then 20 and over. What if your company has, say, 23, but you've got 5 open spots waiting for jobs? Does that matter? Like they're looking for 5 people to fill spots. They actually got 17 now.
So there's always one in every crowd, and I'm no, I honestly, I'm just going to say, so there's 18 people on the group, but you're trying to hire 5 more.
Well, people have left and looking for hiring more, but I just wondered, does that?
I'm going to be truthful. I don't know. Okay. I don't know how they would treat that. We could figure it out probably with a phone call, but I don't guess that's ever come up before. But I'm going to say they're going to probably revert back to the number of people who are on the group, and say that's how many, sir.
At the current time.
At the current time, right. Okay? And any help that anybody else wants to give me with this guy would be great. You ask any question. I'm playing with you. All righty. So we're still on original Medicare. We talked about A. We talked about B. Now we're going to talk about D, which is the only one that really makes sense, because D for prescription drugs, right? This is where the changes are really going to be big this year. Prescription drug coverage. Prescription drug Part D is offered by private insurance companies that are approved by Medicare. They have to be approved by Medicare in order to offer the coverage, and they do a strict policing of these companies. The premiums on your D are going to vary based on the deductibles, the co-pays, and the formulary. The formulary is just a fancy way of saying what drugs are covered under that plan, okay? That's why it's always a good idea every single year, even if you're on Medicare, even especially this year, if you only take a couple of generic drugs, still check. We'll still check your D. We do it for you for free. If you have somebody, have them check it, but make sure that you check it, especially this year. And if you're taking several medications, then I'm going to say definitely 100% check it, okay? So, beginning in 2025, the donut hole no longer exists, okay? Thank goodness, because it's really a pain to explain. So, there is no donut hole going into 2025. And just brief, the donut hole is basically once you and the drug company or you and the prescription drug company had spent a certain amount of money, this year was around $5,000, then you go into what's called the donut hole, and you're responsible for 25% of the cost of the drugs until you reach another level of spending, and then you go into catastrophic coverage where all your medications are free. This year, because of the Inflation Reduction Act, there is no donut hole, and the max out of pocket that any one Medicare beneficiary will have to spend is $2,000. So for people who take a lot of medications, that's great news. For people who don't, guess what? They got to fill in the gap in order the insurance companies won't go broke. Exactly. Now, and I want you to understand also that $2,000 is for prescriptions. It doesn't include the premium for the drug plan. Okay, so if you're paying $50 a month for the drug plan and you're taking Janumet, Eliquis, Xarelto, and Prolia, you're still going to spend that $2,000 on the drugs plus the money on the drug plan.
Question.
Yes, ma'am.
Chemo drugs still not included in this?
Say that again.
Chemo?
Chemo drugs fall under Part B, which is actually a good thing.
Okay.
Because anything given, like, and I mentioned Prolia, and most of the time Prolia, y'all familiar with Prolia, it's an osteoporosis type thing. Do you take it? It's given in your doctor's office, right? So if it's given in the doctor's office, anything given in the doctor's office doesn't fall under Part D, it falls under Part B. So chemotherapy falls under Part B because it's given at a facility. Questioning look.
Out of pocket, that's what I'm looking at.
So for chemotherapy, in our example that we're using here, you're going to be, until we get a supplement, you're going to be responsible for 20% of the cost.
Right, unless you have a supplement.
Exactly.
Supplements. This doesn't help you with that type of an illness then?
No. D does not. D is only going to be for drugs that you get, prescriptions that you get at the pharmacy or mail order pharmacy. Okay? The best way to enroll in Part D, and I'm going to paraphrase that, is either let me or your insurance professional do it for you, because there are some tripping points. You can easily get the wrong plan thinking that you're getting the right one. So have somebody do it for you. We're glad to do it. If you need help with it, just give us a call and we'll be glad to help you. Just like the B, Part B has an IRMA, Part D does also. And this is the year for, this is the numbers for 2024. So the number on the right is the amount that they add to the premium. So for example, let's use WellCare Value Script, which was a 50-cent drug plan last year, and this year it actually doesn't cost anything at all. If you were in the $258,000 to $322,000 range, that $0 drug plan will cost you $33.30. They're going to add that to whatever the premium is. Okay? So there's an IRMA for B and there's an IRMA for D. So the answer to all of these problems, the $1,632 deductible, the $408 copay, the $816 copay, the $204 copay, the 20% that Medicare doesn't pay, are all taken care of by Medicare supplements, also called Medigap. You probably heard them used synonymously, and the reason they call Medigap is because they're designed to fill the gaps in Medicare, everything that we talked about. We're going to talk about the three most popular plans. There's more than three, but these are the three that have the greatest value for the lowest cost, and that is a Plan F, a Plan G, and a Plan N. Most people are familiar with the Plan F and the G. A lot of people aren't familiar with the Plan N, which is one of my favorites, and I'll tell you why in just a second. But the Plan F was considered the Cadillac of all Medigap plans. Covered 100% of everything that we discussed, including the Part B deductible. So if you had a Plan F, if you have a Plan F, all you pay is your premium. You don't pay anything else when it comes to doctor services, hospital services, or anything like that. There's no deductible at all. It covers 100%. It is the most expensive option, and most of you are too young for Plan F because 2019 was the last year Plan F was available for anybody born in 1955 or later. The government thought that it was a good idea to make sure that everybody had at least just a little skin in the game by way of making them pay the deductible.
So F is not available.
If you were born in 1955 or later, it's not available. So if you have a Plan F, right, and you go to change and you were born in 1955 or I said later or earlier, you can still get a Plan F. Okay? I would have probably tried to talk you out of an F because I don't really think that it's a great value because there is a Plan G, and a Plan G is going to be exactly like a Plan F. It's going to cover 100% of all the gaps in Medicare with one exception. And that one exception is it doesn't cover the Part B deductible. So if you have a Plan G, and I was going back to what I was talking about before, making an argument for the plan for Medicare being better, if you have Medicare and a Plan G, you're going to have 100% comprehensive coverage with no network with a $240 deductible. I hadn't seen a whole lot of groups that cover that. Okay? So $240 deductible is a responsibility, and again, I feel that it's a better value than that because there's no convenience charge for covering the deductible. You know as well as I do that insurance companies do absolutely nothing for free. So if they're going to pay that $240 deductible for you, they're going to put a convenience charge on it. They're going to put a little extra. So it's always better for you to pay your own deductible out of pocket and not pay the insurance company for doing it for you. Make sense? Questions? Okay, Plan N, one of my favorites. Why? Because it's the least expensive of the three, and it's going to be just like a Plan F, except there's going to be two differences, and of these two differences, you're only going to see one, especially in this area, and that is after your deductible is met, you pay your $240 deductible. When you go to the doctor, you're going to have up to a $20 copay. So if you don't go to the doctor a lot, it makes sense to go with an N because the premium is usually about $300 a year less than a G. So if you're going to pay a $20 copay, you can see that's 15 trips to the doctor that you could take before a G would have been better than an N. Doctors still, they don't care if it's a G, an F, or an N. They're going to take any one of them. And it doesn't matter if it's Mutual of Omaha, which everybody knows, or Manhattan Life, which nobody knows. The doctor will accept your Plan F, G, or N from any company. Okay? All right, so the second difference, and I'm not going to spend a ton of time on it because you're never going to see it. As a matter of fact, most people in the country never see it. But that difference is that the N does not cover what's called Part B excess charges, whereas an F and a G do. Let me explain Part B excess charges like this. There's two types of doctors in the nation that accept Medicare. 99.25% of the doctors that accept Medicare in the nation take Medicare assignment, which means that they're going to do your procedure, they're going to bill Medicare, Medicare is going to look at that bill and shred it, pay them just a piece of it, but that's the end of the story, okay? The other 0.75% of the doctors in the country that accept Medicare that do not take assignment, if there is a difference in what they bill Medicare and what Medicare pays them, they're going to want that difference from the patient, okay? But it's subject to limitations. They can only charge the patient 15% more than what Medicare pays them. So the example I always use is if you go to a doctor, one of these outlier doctors that don't accept assignment, and it's a $150 procedure, and Medicare pays them $100 for it, there's a $50 gap there that they're going to want from the patient. But because of the 15% rule, they can only charge $15 for that procedure. All right? I've been doing this for a long time, and I have never once, especially in this area, ever seen a doctor that did not take assignment. So it's a fairly safe bet at 99.25% that you're never going to see one either. And my understanding is of the 0.75% of the doctors that do not take assignment, about 80% of those are psychiatrists. So you're in pretty good shape for not ever having to run into that. That's why I like a plan N. It's going to be less expensive. It's going to be more price stable. It's just a better value in my opinion. Questions on F, G, or N?
Is there a way to tell what doctors enroll?
Absolutely. If you go to Medicare.gov, okay, and you look under providers, and you can type your doctor in, and if the statement under his name says, how's it worded?
Should be accepting assignment.
Accepts oh gosh, I can't believe that, I can't remember it. Well, I do it on here, but there's a statement under there that basically says that look under, pull up the thing and just see, and we'll come back to that, but I will let you know. It is, this has got like a complete blank. I ain't done it but 25,000 times. Hi.
Welcome to my world.
Yeah.
Well, I should be able to tell by the verbiage.
Yeah, it's very clear. It's very clear, and it'll say on there that it accepts the Medicare approved amount. That's what it is. Accepts Medicare approved amount. So whatever Medicare decides to pay them, and they accept that. But every doctor that you will see in this area will have that statement. It's Medicare.gov, go under providers, you can type your doctor's name in, and it'll say accepts a Medicare approved amount up under his name, so you know that he accepts assignments. That's what it says.
Charges the Medicare.
Charges the Medicare approved amount, right. Okay? This is a chart that comes in the book, Medicare and You. Most of you may get it, especially if you're on Medicare. And it just kind of backs up everything that I just said, F, G, and N. F, you can see, is 100% all the way down. We did not talk about foreign travel for emergencies. I get calls a lot from my clients and say, hey, do I need trip insurance? Well, if you have a supplement, you don't, because your supplement will pay, in the case of an emergency, if you're in another country, up to $50,000, 80% up to $50,000 with a $250 deductible. Should be enough to get you patched up and sent you back home. Okay? So the F has no gaps all the way down. You can see the one gap in the G, at least I hope you can, right there at the Part B deductible. And on the N, you have the Part B deductible, the Part B excess charges. The two asterisks there under Part B coinsurance are for the $20 copay. And again, you don't pay that copay until after your deductible is met. So if you go to the doctor twice a year, you'll probably never even see a copay. You'll just meet your deductible and that'll be it. Okay? Very important statement. This comes out of the Medicare and You book. Medigap policies are standardized. So I mentioned it a second ago, whether it's Mutual of Omaha or Manhattan Life, whoever it may be, it doesn't make any difference. Everybody's Plan G is exactly like everybody else's Plan G. There's no difference in the coverage at all. So Mutual of Omaha, Manhattan Life, Cigna, Allstate, all of the companies, their Plan Gs are identical, and their Plan Fs are identical, and their Plan N. The only difference is going to be in the price that you pay, which a company like mine, it's our job to make sure that you're always paying the least amount possible. We keep a very close check on it. Okay? So enrolling in your Medicare supplement, the open enrollment, not to be confused with the Medicare open enrollment period, but the open enrollment period for Medigap policies lasts for 6 months. It begins the first day. If you turn 65, January the 15th, your Medicare goes active January the 1st. That is when you're eligible for your supplement, and you can go for 6 months after that and get your supplement. Most companies do allow you to go up to 6 months in advance of that time, and the advantage to that is that you're going to lock your price in. So don't let anybody tell you that Medicare supplements aren't going to go up, because I'm telling you they will go up, and sometimes they go up more than what we're happy with, but we have no control over that. So if your birthday is in January, in July, you could sign up for your Medicare supplement. You don't pay for the time that you don't use, but your price is now locked in for not only that 6 months, but for the whole next year. So it's an 18-month price lock-in. Okay? During your open enrollment period, you can enroll in any plan you want without any questions asked. No background, no prescription check, no anything. It's guaranteed issue, any plan that you want. But it is important to know that after your personal open enrollment period is over and you want to change plans, let's say that you call and say, Bobby, I want to shop my plan, and we end up in Allstate Plan G, and Allstate clicks along keeping their prices steady, but in the 3rd year, it jumps 30%. And then we say, well, we're going to have to go looking around and find something different. They will do underwriting. So they can turn you down after your personal open enrollment period is over. Okay? They're not going to come to your house, and they're not going to take blood. They're not going to put you on a treadmill. But we ask a series of questions. Have you had a heart attack, stroke, or cancer in the last 3 years? And what kind of medications are you on? And as long as you haven't had any of those and your medications are not what's considered a cancelable medication, then you're going to be fine. They look for reasons to take you as opposed to reasons for not to take you, because they do very well on Medicare supplements. Okay? So, that is original Medicare. A, B, D, and Medicare supplements. Yes, sir?
On the supplement plan, is it true that you can only change those once a year?
No, sir. Good question. You can change your Medicare supplement anytime you want. There is no enrollment period for changing Medicare supplements.
So if you're on G and you want to go to N, you can do that at any time?
At any time. Or if you're paying too much for your G, you say, I'm paying $185 a month for G, I can get it for $130. Whenever you're ready, you can do it. Right. The reason is because it is on a annual basis. So if you start in July, your year is up the 1st of July, whereas Medicare Advantage, which we're about to talk about, is on a calendar year. So they only allow you certain times to do that.
And with the open enrollment for the supplement
For your supplement, your personal open enrollment is going to be when you're turning 65 or coming off group and going on to B for the first time. Okay, so now your personal open enrollment period for a Medigap policy is done. So you can change your supplement. You can change your supplement anytime you want. Right. Okay. Yes, sir.
Can I ask you a question?
You can.
The supplemental, that when they put you into underwriting, let's say you're changing and your period, your open enrollment period's closed. What causes them to increase your monthly payment?
Good question. And they can't single you out. They can't single anybody out for a rate increase. It has to be a region that they're doing. So, and they base, like any other insurance premium, they base their premiums on experience. Experience is another way of saying how many claims that they paid. So if they had a bad year, the claims are going to, it's going to go up higher than if it was a good year and they didn't have a whole lot of claims. So it's going to be based on claims, but not you specifically. They can't ever come in and say, we're raising your rate.
And if you didn't want to change at that point because of the increase in the rate, could you go back at another time, and if maybe your health had improved? I mean, how far do they look back? And
3 years. Typically it's 3 years. Some are 2, but most of the time, for the most part, I like 3 years, and it's heart attack, stroke, and cancer are the big 3. And if you hadn't had that in a 3-year period, you're going to be fine.
Can I clear up one question? Along that line, that underwriting is not to determine your premium as much as it is to whether or not you're insured.
Just acceptance, correct. So, and that's a good point, that they're not going to take someone of marginal health and give them a Medicare supplement with a higher premium than they are somebody with great health. Okay? It's pass fail.
Oh, well, that happened to us, though.
Was it United Healthcare? Okay, I was going to say, with the exception of United Healthcare, they do have 2 rates.
And it was because of a one medicine for peripheral vascular disease. They said, no, automatically you get both.
You get to the what do they call it?
500
Stand. Oh yeah, no, it's nobody ever takes it. It's like 3-4 times
So
higher.
most other supplements don't do that?
Most don't do that. Most have a pass fail.
Okay, thank you.
Okay.
Stay away from United Healthcare.
No. United Health is a great company. Stay away from their higher rate. Yeah, for sure. Yeah. Okay, so we're going to talk about Medicare Advantage. We talked about A, B, and D with original Medicare. Now we're going to talk about Medicare Advantage with the missing letter of Part C. Basically, Medicare Advantage is a grouping or accumulation of A, B, D, and a supplement all together. You may have even heard it called an all-in-one plan. It's because it includes all of these items, okay? And again, it's just another way to receive Medicare coverage. It's offered by private insurance companies, again, that are approved by Medicare. Now, this is, the question I get all the time is, what is the main difference between Medicare Advantage and original Medicare? And that is this, that with original Medicare, your Part A and your Part B is overseen by the government. They're the ones that make the decisions on whether they're going to pay your claim or not. When you go to Medicare Advantage, if we say end up in Blue Cross Blue Shield or Humana, United Healthcare, whoever it may be, they're the ones making the call on your Part A and Part B. Now understand this, Medicare supplement companies strive for star ratings. Star ratings are very important to them, 1 through 5 stars, because if they achieve a 5-star rating, they can accept applicants year-round. They are not governed by the enrollment periods. They can take somebody in July if they want to, right? So what hurts star ratings? Complaints, appeals, complaints by doctors, complaints by patients, and things like that. They don't want to be appealed. So they don't just turn down a claim because they want to turn down a claim and don't want to pay for it. Okay, so if that happens, there is an appeal process, and that appeal process ends back up in CMS, the Center for Medicare and Medicaid Services. Okay, so it's not, they just don't have free will to turn anything down that they want to turn down. There is an appeal process if you're not happy with the decision that the Medicare Advantage company makes, okay? So that's the main working difference. One way is going to be through private insurance. The other way is going to be through the government. And it's going to be more like traditional health insurance with some co-pays and some max out-of-pocket provisions. It does offer supplementation for a lower premium than Medicare supplements. Most of the time, and in this area, 100% of the time, a Medicare Advantage plan has no cost. It doesn't cost anything. You still have to have your B, and you have to maintain your B, and you have to pay for that. But there's no charge for D. There is no charge for the supplementation, and there's going to be some other non-Medicare benefits that you're going to get at no cost. Dental, vision, gym memberships, and in some cases, even they have an over-the-counter allowance that they'll give you. Now, when I say that dental and vision and hearing, I didn't put hearing up there, are non-Medicare benefits, let me be clear that if you have macular degeneration or if you have glaucoma or cataracts, Medicare does cover that for your vision. But just to go get an eye exam and get new glasses or get new contacts, there is no coverage in Medicare for that. Okay, the same thing with dental. If a person had an accident and had their teeth knocked out, Medicare is going to cover that. If they have a disease that I hate to use the word rots their teeth, then Medicare is going to cover that. But just to get a cavity filled, a root canal, a cleaning, or whatever it may be, there is no coverage in Medicare for that, but there is in Medicare Advantage plans. And like your group or private insurance companies, or private coverage, networks are used to hold the costs down. You're not able to go outside the network, in some cases at all, and in other cases not without incurring additional costs. We'll talk about that in just a second. And like most group coverage, you're going to have a max out-of-pocket, like we talked about earlier, and it's going to range, depending on what plan you choose, between $3,000 and $7,500 a year. That's not a deductible. That is accumulation of copays. So let's take Humana, for example. If you go with Humana and you go to see your primary care, there is no Part B deductible. There is no charge to go see your copay. It's zero. It doesn't cost anything. If you go see a specialist, it's $25. Is it $25? Yeah. $25, okay? That $25 goes against that out-of-pocket. If you had to go into the hospital,
MRI is $200.
An MRI, like we talked about before, is $200. That'll go against that max out-of-pocket. Okay, if you had to go into the hospital, I believe it's $300 a day for the first 5 days, right?
I don't know, I've never been in the hospital. I mean,
Yeah. So there is a copay for that. Again, all of that goes to determine your max out-of-pocket, the amount that you will never spend more than. Okay? And there's never any underwriting with a Medicare Advantage plan. So it doesn't matter your state of health. If you want to change and go to a Medicare Advantage plan, they have to accept you, okay? So there's never any problem with any kind of the cancer, the strokes, the heart attacks, or anything like that if you want to go with Medicare Advantage. Now this is kind of a heads-up comparison between the two that may help a little bit if you're trying to determine which way is better. If you go with original Medicare, Part A, as we know and talked about, is free. For most people, Part B is $174.70 a month. D is going to average, and I just changed this today, from zero, which is we talked about the WellCare Values Group, all the way up to $150. It's going to be based on what you take, okay? And that's kind of an in-depth analysis to determine which is going to be the best drug plan. Supplements are going to range from 85 to 110. I probably should have fixed that. It's more like 120 depending on what plan that you take for most 65-year-olds. The greatest thing about original Medicare is that right there, there are no networks. It's accepted anywhere. Your Medicare red, white, and blue card, your Medicare supplement is accepted anywhere that Medicare is accepted. It doesn't matter what city you're in. It doesn't matter what doctor it is. As long as he accepts Medicare, he's going to take your Medicare supplement.
Internationally?
Well, remember on the international part, right? We have the emergency coverage with the supplement. Medicare itself, I believe, I have not read the book this year yet, but typically it will cover Canada and Mexico, but not France and Italy because they're not touching the United States. Now, a Medicare Advantage plan, just to compare, does have international coverage, complete international coverage. Humana, I know, does. Blue Cross does. They all do.
U.S. territories will be covered?
Yes.
Okay.
But with original Medicare, like we mentioned, except for the cases that we talked about, there is no dental, vision, or hearing coverage. Again, you know, if it's macular degeneration or anything like that, that is covered. But just regular eye exams, teeth cleanings, cavities, root canals, that's not covered under original Medicare. Part C, A is still going to be free. We're still going to have to pay for our B, which is $174.70, but the D is included. And the supplementation is included. It's zero premium in most cases. Networks are used to hold the cost down as opposed to no networks with original Medicare. Now let me talk about that for just a second. We typically like to go, we represent every one of them, but we do like to go with the companies that have the larger networks. The Humanas, the Blue Cross Blue Shields, United Healthcares, those are the companies that have the big networks. With the exception of United Healthcare, they take those those groups take all hospitals. United Healthcare is not in Baptist, except for their dual eligible plan. But for you guys, if you had a United Healthcare Medicare Advantage plan, you couldn't go to Baptist Hospital. With Blue Cross Blue Shield or Humana, you could. With Aetna, you couldn't go to Methodist. With Cigna, you couldn't go to Baptist. So there are some provisions. I know. I've done this once or twice, so I remember all of these companies.
So is there such a thing as an out-of-network coverage?
Good question. So I was going to talk about that. So thanks for bringing that up. Within Medicare Advantage plan, there's an HMO and there's a PPO, right? An HMO, you have to stay within the network. You can't go out. There's no coverage outside of the network at all. Now, again, with companies like Humana or United Healthcare, their HMO plans, the networks are very, very large. So you don't run into it a lot of times.
You still could get into a network in another town or something.
I'm so sorry.
If you were traveling.
Yes, and they all have travel provisions. For example, Humana. Humana does have a travel provision. If you're in Eugene, Oregon, and you turn your knee and you need to go see an orthopedic, you just call Humana and say, "Hey, I'm in Eugene, Oregon, and I need to go see." They will find you a network orthopedic to go see. Okay, so there are, provisions for that.
What if you're on a cruise?
I'm sorry.
Caribbean or wherever around the world?
So now there's two of them. I'm kidding. I would have to think that you're on the cruise. It's international waters, and it's going to be, if you're on a supplement, your $50,000 will come in, and if you're on, they're always going to take care of emergencies, even if it's out of network. So if you're in an area, and again, I keep using Humana, but if you're on Humana and you're in a small area in Wyoming, and the only hospital available, and you got a gash on you, you need to get it sewed up, they're going to pay for that, even if that doctor is not, even if that hospital is not in network.
Buy your travel agent's insurance. Travel insurance.
Well, you could do that. Okay. All right. Again, with our comparison, Part C also, again, does include dental, vision, hearing, gym memberships, and over-the-counter benefits. Let me give you some examples. I'm not allowed to say company names other than if I'm talking generically, but for the most part, I know three of the companies. Dental, you'll get about $2,500 in dental a year. You'll get $225 to $300 for glasses. You get the free eye exam. Hearing aids at huge discounts, like I know one company for $699 it was this past year. I haven't seen it this year, but for the premium level hearing aids that are like $5,000, you pay $699 for it. So you get good coverage for that. And in no case have I ever seen Medicare by itself pay for hearing aids. Okay. Gym memberships, you've got three different. You got Silver Sneakers, Silver and Fit, and Renew Active, depending on what plan you're on, but most gyms that you'd want to go to are in those programs. And over-the-counter benefits, actually they've been cut a little bit this year because Humana, maybe I shouldn't say, but I think it was $150, $125 last year per quarter. This year it's going down to $50. The card, and I'm speaking to you directly, the Flex card that you got last year, they're not having those this year.
It's pretty worthless though. It was only good for certain things. You just couldn't use it for any kind of medical thing.
You couldn't use it for copay?
No.
Does it cover the gym on a cruise ship?
I'm sorry, does that what?
Well, less than the gym on a cruise ship.
Well, I think if you're on a cruise ship, they'll let you go to the gym for free. I went on an Alaska cruise last August, and I, after poking around a little bit, and I was surprised that they actually have a morgue on the ships, and they tell me that no, there's a morgue on every ship. Because typically it's like us, it's a more senior group that are on cruises, number one, and number two, we sit and eat and drink too much, so I think that they're ready for us with the morgue in case something bad happens. You what? Say
Does
again?
Medicare cover your mortuary services?
Why would you care? You're not. Well, I'd leave somebody else with the bill. All right. So, that is Medicare Advantage. Two choices, original Medicare or Medicare Advantage. One's not any better than the other. It just depends on your situation. We don't try to lean one way or another. We present all of the facts and say, here's what it would be this way, here's what it'll be that way, and together we can come to a decision on which is the best route for
more
you.
personalized to the need.
100% personalized.
You can't sell it one way or the other. It's individual.
I would never be able to look at you and say, you need to be on a Medicare supplement. Now, if you told me that you are stage 4 pancreatic cancer, I would say absolutely 100% we need to be on a Medicare supplement, because I don't have to worry about your max out of pocket. I know you're only going to pay your premium and everything else is going to be covered 100%. So,
How many companies are there on this supplement, on the Medicare Advantage? How many companies are?
how many?
Under that
Yeah.
umbrella of Advantage.
Okay, WellPoint, WellCare,
I've tried about 8 or 10.
yeah, at least Cigna, Aetna, United Healthcare, Humana, Blue Cross Blue Shield.
Anthem.
Well, Anthem is WellPoint. I'm probably leaving somebody out. Zing, there's a new one this year. Zing, Devoted.
They're all the same in regards to the services that they provide?
Absolutely not.
Okay, so that'll be the next question is, where can I go to compare?
Me or your insurance professional, whoever that might be. If you have somebody, they can compare it for you. We'll be glad to do it because that's all we do. We don't do car, we don't do house. We do Medicare full-time year-round.
Okay.
I've got a team of 18 people who help me do it.
And you're in Memphis?
We are in Memphis and in Jackson. I have an office at 5050 Poplar. I call the White Station Tower. I think they call it the iBank building actually, but I'm old so I can call it the White Station Tower. But and then in Jackson, Tennessee, we have an office right off the bypass at Union University Drive. So that's new. We've been open since July there.
And this is Mike, and he's running that office.
Yeah, my manager for that office is here. All right. So any questions about what we talked about so far?
There's more.
Well, I've only been here for 45 minutes, and I had 2.5 hours. So we've got a. Larry said keep you engaged. Larry said keep you engaged for 2.5 hours. So. Well, if all of that wasn't, I'm sorry. Did you say so? Okay. If all of that wasn't confusing enough, there are the Medicare enrollment periods to confuse you further. There is the IEP, which is the initial enrollment period. There is the AEP, which is the annual enrollment period. There is the OEP, which is the open enrollment period. There is the GEP, which is the general enrollment period. And there is the SEP, which are special enrollment periods.
Okay, question.
Uh-huh.
I'll provide a copy of this presentation.
Yeah.
We will have the
If
slide.
you're already on a plan like Humana, I can change it whenever I want, or is that, no?
No.
Like if I want to go to Blue Cross Blue Shield?
Okay. I'm about to answer that question.
Okay.
Your initial enrollment period,
Is she talking Part C?
I'm sorry, C.
Part C for
Mm-hmm.
advantage, okay.
So the initial enrollment period is the period that is 7 months. It's when you turn in 65. 3 months before the month you turn 65, including the month you turn 65. And for 3 months after you're in your initial enrollment period, that's when we want to get you signed up for your Part A and B. If you're going to go full Medicare. If you're only going to go Part A, that's when we want to do that. There's no penalty, huge penalty for doing it later. But that is your initial enrollment period. The annual enrollment period starts 1 week from today, October 15th through December 7th. During that time, if you're on a Medicare Advantage plan, that's when you can change and go to another Medicare Advantage plan. If you went the other route and went with original Medicare, that's when you can change your drug plan. Again, you can change your Medicare supplement anytime you want to. There is no specific period for that, okay? The OEP, the open enrollment period, is January 1st through March 31st every year, and it gives you another opportunity to change your Medicare Advantage plan. It only applies if you're on a Medicare Advantage plan, and during that time, you can change again. So if you, for example, during this annual enrollment period, changed from Humana to Blue Cross in about February or early March, you said, Bobby, I don't like Blue Cross Blue Shield. I want to go back to Humana, or I want to try United Healthcare. You get that opportunity again, January 1st through March 31st. Yes, sir.
If you sign up for original Medicare, can you change to?
Absolutely.
Okay, and just during.
And if you went to Medicare Advantage, you can go back to original Medicare. Understand though, that if you choose Medicare Advantage, you get a full year, the first year in it, that you can go back to original Medicare at any time. You can do it in June, July, August, it doesn't make any difference during that first year. Outside of that first year, you will be constricted to and it's a 6 month, pretty much a 5 to 6 month period, October 15th through March 31st, with the exception of the holidays, you can change back to original Medicare at any time. Again, during that first year, if you decide that you don't like Medicare Advantage and you want, even if you don't have to be the first time, if it's the first time on a Medicare Advantage, if you've been on original Medicare for 5 years, and a supplement, and you say, hey, I want to try this Medicare Advantage, and you try the Medicare Advantage and you decide you don't like it, anytime in that first year you can go back to where you were without any questions asked. And a lot of people don't, so you hear all the time, I'm going to be stuck in a Medicare Advantage plan. We're not going to let you get stuck in anything.
So if I want to game the system, what I'm hearing you say, if I want to get hearing aids at a certain reduced price,
you know,
go to one plan and I flip over to the other plan.
You need to move over and sit by this guy, but yes, that's actually true. And honestly, I've done that before. I had a guy said, I want original Medicare. He said, but man, I can't hear it. I can't spend $5,000 on. So we put him on a Medicare Advantage plan for that first year and moved him off of it at the end of the first year and put him back on original Medicare, and he had his. I'm for you guys. I'm not for the insurance company. Yeah. So no, very true.
That applies if it's going on a cruise.
Yeah, on a cruise. And you want to work out on the cruise.
I know that.
So anyway, you got your open enrollment period. That's only for people on a Medicare Advantage plan. You can't change your drug plan during the open enrollment period. You can only change it during the annual enrollment period, but you can change your Medicare Advantage plan from January 1st through March 31st if you're not happy with the choice that you made. So we're not going to let anybody get stuck in anything. Okay? The general enrollment period only applies if you miss your initial enrollment period. Used to be, and 2 years ago it was, that if you had to fall in the general enrollment period, which was January 1st through March 31st, your Medicare didn't go into effect until July 1st. But now they will do it the next month. So if you miss your initial enrollment period, you sign up in January, it'll go effective in February. Okay?
What are the late enrollment penalties?
Late enrollment penalties are 10% for Part B per year for every full 12 months. So if you're 11 months late, there's no penalty. If you're 12 months late, it's a 10% penalty of the current Part B premium, and it never goes away.
It's a penalty for life,
for the rest of your life. And D is the same way, except it's not 11 months, it's 63 days. So if you don't sign up for D, so a person says, well, I'm going on Medicare and I've never taken a medication in my life, and then 3 years after, they say, now I'm taking medicine, it's expensive, they want to get a D, there's going to be a penalty. That penalty is roughly about 35, it's 10% of the average of all of the Medicare Part D premiums, so it happens to be about $35, or at least it was last year. I hadn't seen what it is this year. So your penalty would be 35 cents a month for every month that you didn't have it. So if you went a whole year without Medicare Part D, you're going to have a $4.20 per month period for the rest of your life. Okay?
But if you're insured You don't have to.
You don't have that.
None of this now.
Creditable coverage, which is coverage which is at least as good as Medicare. And let me say this, and it's not effective this year, but I would imagine it's going to be next year. Most group coverage does not have a $2,000 max spending on. So if you have a group coverage that's got a $5,000 max out of pocket, right? That's not going to be creditable coverage next year, because it has to be as equally as good as Medicare. Medicare only has a $2,000 max out of pocket spending for drugs. So if it doesn't match that, then it's not going to be creditable, and you will get the penalty when you do go on. I know. They make it confusing and hard to understand, so I'll keep a job. It's basically because I can't do anything else. So this is what I get to do. So as long as they can make it confusing, it's fine. So special enrollment periods include things like leaving your group. Remember, we talked about special enrollment. So if you stay on your group for 3-4 years, however long it is, you had creditable coverage. We get a form filled out. We apply for your B. We attach it. No questions asked. You're in a special enrollment period. No penalty. Remember, I mentioned CMS 5-star rating, how important that is. So if a company, and actually, again, Humana has a 5-star rating on their Humana Go Plus plan, they can accept people anytime. So if you're on United Healthcare in July and you get mad at United Healthcare and you want to change to Humana, because they have a 5-star rating, you can move to Humana anytime you want to. The star ratings aren't out yet, so we don't know what this year holds, okay? Moving out of the service area. If you move, you're going to move from Memphis down to Florida. That is a special enrollment period, and you have the opportunity to get a local plan, because most plans are regional, especially when it comes to drugs and Medicare Advantage plans. Okay. Dual eligibility if you're on Medicare and Medicaid, and certain declared disasters. So Florida, for example, will probably extend, by way of a special enrollment period, because of the hurricanes that have hit and are about to hit. They will extend the annual enrollment period probably until April or May of next year. For Florida, right, for the specific area that has the disaster. They call it disaster. North Carolina, East Tennessee, all of those places probably will have special enrollment periods that extend the annual enrollment period. Medicare is really big on acronyms, so basically what that is an SEP to extend the AEP by way of a DST. So, I know, it's fun, isn't it? Okay, so.
Well, I'm sorry, talking
no
about
problem.
something that you mentioned, that depending on where you are, that the drug plans are going to be different. Do you have any statistical data that will tell you where it's better?
Where it's better? No, it's probably not gonna vary a ton.
Okay.
Things like supplements do.
Okay.
Medicare supplements are a lot higher in Florida than they are here.
Okay.
They're cheaper in North Carolina than they are here.
Okay.
But they're higher in Florida, but the Medicare Advantage plans are a lot better in Florida than they are here, because their max out of pocket is a lot lower.
Okay.
So a max out of pocket here for Humana is $4,400 this coming up year. No, it's $4,900 this coming up year. In Florida, it's probably $1,500.
Oh, wow.
So it's cheaper there to pay the max out of pocket than it is the $250, $300 a month you might have to pay for a supplement.
Gotcha. Okay.
Okay? So, a little bit about us, Delta Medicare Benefits Group. We are a nationwide agency. We represent every top carrier in the market. So we have them all. We have absolutely zero, like I mentioned before, preferential. We don't care if you like Humana, Blue Cross, United Healthcare. They all pay us the same. It doesn't make any difference. So we're not monetarily motivated to put you in one company over another, because they all pay us exactly the same thing. So it doesn't make us any difference. We want you guys to get the best coverage, make sure your doctors are in network, your drugs are treated the way that they need to be treated, and you get all of the benefits that you want.
So
Pay you, they pay you.
Correct.
Got it.
We educate you, keep you up to date with Medicare. We're going to shop your premium every year and to assure that you're always getting the very best coverage. We're not going to bug you to death if you're our client, but if you add medications over the course of the year, we need to know so we can tweak your plan when the time comes. We don't like surprises when it comes to health insurance. And the very best part of it all is our services are absolutely free. As I mentioned, we are paid by the insurance company, so you never owe us a dime. Okay? Any questions?
Yeah.
Yes, sir.
Okay, I'm still working. When I go to leave work, how do you put up a certain date or time to start Medicare B? Or
Yeah, good question. So when you're getting A, let me back up and say, if you're going in and you're going to get A and B at the same time and during your initial enrollment period, it takes about 2 weeks.
Okay, but it's not the initial enrollment.
Right. If you get your A and then go and get your B later, it takes longer to get your B. I don't know why, but it does take longer. I think they have to verify your existing coverage and things like that, but it could take a month, sometimes 6 weeks. So I always like to do it at least a couple of months before. So if you're going to retire in January, I'd like to do it in no later than November, just to allow plenty of time in order to make sure that, we don't have that period that you don't have coverage.
The annual enrollment period, you mentioned earlier in the first part of your talk about numbers not coming out till the 1st of November.
Right.
You recommend waiting until after November 1st to go?
No, because it's not going to really, and only numbers that are going to come out that we don't know are for sure are the Part B premium, which is, I've heard 185, the Part B deductible, which is 240 this year, and it probably will go up to, I'm going to guess, 260, 275. And then the other things like the A deductible, the Part A deductible, 1632, it'll go up, but it won't really matter because it's covered by your supplement anyway, or it's covered by your Medicare Advantage plan either way. So it's just for informational purposes, so it really is no advantage to waiting.
What about the Part D plans?
D, we know. We know D. I know the deductible this year for Part D is $500, and I should have said that before. The deductible for Part D is $590 this year. All right. Now, that does not apply to Tier 1 or Tier 2 drugs. Amlodipine, losartan, atorvastatin, rosuvastatin, those are Tier 1 drugs. It doesn't apply, Tier 2 drugs, it doesn't apply to that. You may have a small copay, $5 to get that medication. Some you won't have any, but you have $5. But if you move up to a Tier 3, Eliquis, Xarelto, things like that, you're going to have a larger copay, or you're going to have to meet that deductible first.
As far as their formularies, are they usually?
They're out. They came out a week ago. They came out October 1st.
So if I want to see, want to stay on the current plan and go to a different plan because of their formulary?
We can know now. Right. We know exactly, all the plans have been released to us. We can share them with you. We can't enroll you in them until October 15th, next Tuesday, but we can certainly get everything lined up and ready to enroll October 15th through December 7th. So if you want to check, give us a call and we'll be glad to do that.
Yeah, I just like to compare because.
Oh, no, in this year, it's very important to compare.
Yeah, I mean, one month, prescription drugs change.
Oh, yeah.
So one may be more expensive.
Absolutely. And they are. And the copays have gone up, the deductible, the premiums have gone up for the most part. United Healthcare's drug plans, I think the cheapest one this year is $54. So Humana's got a lower end one of 20 something, and then they go up from there. But yeah, no, this year, I'm telling you, if you guys are on drug plans, if you're on Medicare Advantage plan, make sure you check, make sure your drugs are going to be in the formulary, and make sure that, because I've seen stuff like, I went back to WellCare Value Script. The WellCare Value Script, which is a great plan, this year doesn't cover albuterol. I mean, in this area, everybody takes albuterol. It's a allergy thing. So anyway, yes, sir.
Y'all help last year with my enrollment, are you going to review those plans automatically, or do I need to?
You need to call. I mean, I've got about 8,000 customers, so definitely call. We're glad you. We try to remember everybody, but it's hard. Who? Kim? Okay, yeah. And Kim is still about. She was supposed to be here, but she did get ill, so she couldn't come. But reach out to Kim, and she will certainly help you again.
All right, Bob. Thank you, sir.
All right. Thank you.
Before the meeting, Bobby shared with me the one thing that I want everybody to know from all of this data that he gave. So if you've got your pens handy, let's get this one thing done. 901-460-7220. Yes, that is his initial phone number. That number is good from 3 hours ago, including this meeting, and will be good for the first 3 hours of tomorrow's business day. If you do not get in, you can simply call his annual phone number, which is good pretty much any day of the year that ends in Y. Should you get that group, they will then refer you to their open phone number, followed by the general phone number, the special phone number, the secret phone number, where you will ultimately land into their 5-star phone number and reach an agent from there. So thank you all for coming out for this month's installment of the Radian Partners Ignite series. On your way out, all you trick-or-treaters, we have some probably not sugar-free candy that is, however, guaranteed not to cause tooth decay. So make sure you help yourself, and we'll see you next month.